Hello, my name is Esperanza, and today I'm going to be conducting a nutrition physical assessment. For the assessment, it's going to identify whether or not you might be deficient in any micronutrients. It'll also look for any sort of muscle or fat wasting. Ideally, before we do get started, we would be washing our hands with soap and water and also putting on gloves. And do you have any questions before we move forward?
No.
So ideally, we will want to start off with the assessment from head to toe. Ideally, with the hair, we wouldn't want it loose so that we can observe for any sort of baldness or patches throughout the hair. Today, we're going to go ahead and just observe what she has her head with her bun. Do I have permission to touch you?
Yes.
Okay, so we're going to go ahead and look for any sort of color, any sort of texture throughout the hair. Have you noticed any changes throughout your hair?
No.
Okay, and it doesn't look like we've noticed any sort of balding. So typically, if there's any sort of a micronutrient deficiency, you will notice any sort of balding or patches throughout the hair. Next, what we're going to go ahead and do is move towards the eyes. So around the eyes, we're going to go ahead and take our hands and pat down the temples and the orbital pads. So we're going to go ahead and identify whether or not there's any sort of darkness in color, any hollow around the eyes. So we'll slightly just pat down here. They're nice and cushioned. And here on the temples, we'll notice if there's any sort of indents or any sort of hollowness throughout that section, which she's perfectly fine. Next here, we'll go ahead and take a look at her around her mouth to see if there's any sort of cracks, any sort of signs of any dryness that would indicate any sort of dehydrations or also any sores. Have you noticed any changes around your mouth or inside your mouth?
No.
Okay, and can you open up your mouth for me? So when we ideally look inside of the mouth, what we're going to be searching for is if there's moisture in the mouth. If there tends to be any sort of dryness, that would indicate that there is dehydration. And also in the color of the skin, if it was a magenta, then that would indicate a micronutrient deficiency. Have you had any issues with any chewing or swallowing?
No.
Okay, can you please smile? So we do want to assess the teeth in case any of the patients do have any sort of missing teeth. We want to ensure that if they're having any sort of trouble with swallowing or chewing any sort of food. Everything in our mouth seems fine. And also, can you make a blowfish? Okay, and then can you also make a kissing face? So I also want to make sure that the patient is able to conduct these two assessments in order to make sure that they're not having any sort of microdeficiency. And okay, next with your tongue, what I'm going to go ahead and do is touch your cheeks, and you're going to go ahead and touch your tongue against my fingers. Thank you. And over on the other side. And you want to look for the strength with the tongue when you do that movement. Next here, we're going to be assessing and doing an observation of the clavicle. Typically, if there's any malnourished patient, you will see a protruding clavicle bone. So here, have you noticed any changes?
No.
Okay. So you can see that her clavicle bone is not appearing as protruding. So it's great. And then also, right after you're assessing the clavicle bone, next you'll want to go to the deltoid area. And here, what you can also do is ask the patient to go ahead and put their arm forward and push against my hand so that we can assess the scapula in the back. Typically in the back of the scapula, you'll want to feel for a shelf shape in the back just to ensure that everything is fine and firm back there. And while you have your hand out, you can check your nails. Here, with the nails, you can observe for the color and also the shape of the nails. If in case there is a spoon shape, that would indicate an iron deficiency. And if there is any sort of ridges, that would indicate a protein energy malnutrition. And here, can you hold up your arm at a 90-degree angle? Okay, and here we're going to go ahead and feel for the bottom. We're going to want to do a slight pinch, and as long as there's not, I can feel some skin in between my two fingers, that indicates that that's a good enough cushion there, and that's just not any wastings being identified here. Typically, you'll know if your fingers are touching or if there's a smaller amount that there is some indication of malnourishment there. Well, I do have the patient's hand up. What I'll go ahead and do is assess for the ribs and make sure that there's not any protruding ribs occurring here. And then from there, what we're going to go ahead and do is move down to the lower extremities. So from here, we're going to go ahead and meet the middle of the patella and the hip bone, and to assess the muscle of the quads. And here, we'll also want to ensure that we're making sure that each of the quads are identical and that one is not slimmer than the other. And we'll also check for this when it comes to the calf bowl. So we'll make sure that each of those are both even. Unfortunately, I'm not going to be able to show you here on the picture, but it looks like both of her calf bowls are both even. And next, once we're done at the lower extremity section, we'll want to check for edema. So with the edema, what we'll go ahead and do is I am going to push against the skin for 5 seconds and see if in case there's any swelling. And in that case, I can also take a measurement of how the depth of the indentation is in order to determine the scale of edema. And there's no indication of the edema on her feet.